8:17 p.m., and the ambulance bay looked like a mirror that could not hold still. Rain sheeted off the awning, hit the concrete, and burst into cold spray. Wind off the harbor carried salt diesel and a faint, scorched tang. The back doors of Rescue 2 flew open. The gurney came in hard wheels, rattling over the threshold, paramedics running it like they were late to the only thing that mattered. A dark ribbon of blood followed steady enough to make the fluorescent light feel cruel. "Trauma 1, the charge nurse called. Male early 30s, the lead medic said, breath tight. Blast injury, right side, he's crashing. Dr. Priya Shah stepped into the lane and lifted one hand. People moved around her without touching her, the way traffic parts for a siren. Her gaze locked on the man's chest. On 3, she said. 1, 2, 3. They transferred him to the trauma bed. Fabric that had once been tactical gear hung in ragged strips where scissors had chewed it away. The man's skin was gray under the lights. His mouth hung open. Each breath came with a wet, stubborn rasp. His name was on the sheet, clipped to the rail. Jace Calder. Airway? Shaw asked. Patent, the medic said. Barely. He's working for it. A nurse snapped on gloves. Another slid an IV catheter between fingers that moved like a metronome. The overhead lights clicked brighter, and the glare turned gauze at Calder's right flank into something almost black. 2 large-bore IVs, Shaw said. Trauma labs, type and cross, portable chest film, ultrasound ready. Sedation, the intern asked, already glancing toward the cart. Not yet, Shaw said. Not until I see what his body is doing. The monitor threw green peaks across the screen, heart rate high and climbing. Oxygen dropping in stubborn steps. Blood pressure sinking, catching, then sinking again like a hand slipping off a ledge. A suction canister snapped into place. Tape tore with a sharp rip. Someone counted out loud as if numbers could build a fence. 2 units on standby 4 minutes out. A warming blanket landed over Calder's legs and darkened where blood had already found it. The glass wall of the bay held a row of black blinds, half raised, half hiding the corridor. Shaw's fingers hovered near his sternum, not touching yet, reading the rise, the lag, the faint tremor in his abdomen on every inhale. Right side's fading, she said softly to herself. At the edge of the bay, security drifted closer, drawn by alarms and speed. The officer's eyes stayed on the patient's hands. Inside, the air smelled of antiseptic, warmed plastic, and latex. A supply cart rolled into place at the far side of the bay. The nurse pushing it did not hurry. Plain navy scrubs, hair in a low knot. Her badge said Mara Keene. She stopped, locked the wheels, and watched. She watched the medic's palm pressed hard to Calder's dressing, watched the way Calder's ribs moved unevenly, the right side lagging behind the left by a fraction that made the room feel smaller. Pressure's falling, a nurse called. Fluids wide open, Shaw said. The medic lifted his hand long enough for the team to see what he had been covering. Gauze peeled back heavy and glossy. A thin string of clot stretched, then snapped. Beneath it, the wound did not look like a simple tear. It looked pushed inward, turned and torn along a path that had direction. Shaw leaned closer. Her face stayed calm. Her fingers did not. Chest tube tray on standby, she said. Call respiratory now. Evan Miles slid in with the portable ultrasound, too eager to be useful, eyes too wide under the mask. Sir, can you hear me? He asked. Calder did not answer. His lashes were wet. Rain sweat, it was hard to tell. His jaw was clenched so tight, the muscle jumped once, then settled. Above them, one of the fluorescent lights flickered. A brief stutter in brightness. A few heads tipped up, annoyed, then dropped back to work. Mara Keene's eyes tracked the flicker like it mattered. The light flickered again, and the hum with it a quick high buzz that made teeth feel wrong. Mara reached up and pressed 2 fingers against the underside of the housing, not fixing it, just steadying it. Then she lowered her hand and returned to watching. Calder's left hand twitched near his hip. It curled open and searched the air a few inches above the rail, as if looking for a grip that was not there. The medic saw it and muttered a curse. He's coming up, the medic warned. Security took a half step forward. No restraints, Shaw said without looking away. Not unless we have no choice. Calder's breathing hitched. His shoulders tightened. For half a second, his whole body went rigid like a spring wound too far. Then his eyes snapped open. They were not glazed. They were sharp, focused, angry. He sucked in air like he meant to steal it from the room. His gaze swept the ceiling, the corners, the door, and landed on hands reaching toward him. His right arm shot up. Fingers closed around the oxygen line and tore it free in one violent motion. Plastic snapped loose, whipped against the bed rail, and the monitor answered with a rising scream. The scream from the monitor turned the whole bay into a single nerve. Get that back on, Shaw said. Calder's head snapped toward the nearest hands. His eyes were wide, not unfocused, and they did not look at faces for long. They checked angles. Doorway, ceiling, corner. the blank space above the cabinets where nothing should move. A nurse reached for the cannula. Calder's elbow drove up hard and fast. Not a punch. A block. His forearm slammed into her wrist and knocked the tubing away. Plastic skittered across the sheet. "Do not touch me," he growled. His voice was low, but it had weight, the kind of sound that made people obey before they knew they were obeying. "Oxygen now," respiratory said, stepping in with a mask. Calder turned his head like he was tracking a threat. His right hand shot out again, searching, grabbing air, then locking on the edge of the bed rail. His fingers curled with purpose. His knuckles widened. "Sir, listen to me," Shaw said. She leaned in just far enough to be heard, not close enough to be grabbed. "You are in a hospital. You are bleeding. You need help." Calder's eyes flicked to her badge, then past it. He did not look at her mouth. He looked at her hands. "Hospital," he said, and there was something bitter in the word. "Yeah, sure." He planted his left heel and shoved. The trauma bed lurched sideways and hit the metal bumper with a sharp clang. A tray rattled. A pair of forceps danced, then fell. Someone cursed under their breath. "Back," Shaw ordered sharp. Security moved in. Officer O'Hara was already at the foot of the bed, one hand half raised, like he could catch violence in the air. "We should restrain," O'Hara said. "No," Shaw replied. "Not yet." Calder's chest heaved. The right side still lagged. That delay showed in the way his shoulders rose uneven. He was trying to pull air through a lung that did not want to cooperate, and he was angry about it. Respiratory brought the mask close. Calder knocked it aside. He did not slap at it blindly. He redirected it like it was a weapon pointed wrong. "Stop," a nurse pleaded, voice thin. "Please." Calder's gaze snapped to her. Not cruel, not soft, just calculating. "Where are they?" he asked. No one answered because no one knew what he meant. Evan Miles stepped up with the practiced tone of a young doctor trying to borrow authority from language. "Jace, you're safe. You're at Harborview. We're going to treat you. We need you to stay still." Calder's eyes narrowed at his first name. "Who told you to say that?" Calder asked. Evan blinked. "It's on your chart." Calder let out a short sound that might have been a laugh if it did not have steel in it. "Chart," he said, and looked past Evan's shoulder at the glass wall. The corridor outside was a smear of white light and rain shadow. The blinds were still half raised. He stared at that narrow strip like it was a sight picture. Shaw reached toward his flank, dressing again. Calder's hand shot out and seized her wrist. The bay froze. His grip was not shaking. Even with blood loss, even with pain, it was controlled. He did not twist. He did not yank. He held her right at the edge of discomfort, where a person could still pretend it was not fear. Shaw's eyes did not drop to his hand. They stayed on his face. "Let go," she said. Calder did not. "You move like you have a team," he said quietly. "Where's your rear security?" Shaw inhaled once. Slow. Then she did the only thing that worked with men like this. She spoke like she believed herself. "Rear security is a locked death door and a badge reader," she said. "We are not your enemy. Let go." Calder's gaze shifted quick toward the door. He stared at it for half a second as if he could hear the latch. Then he looked back at Shaw. His thumb tightened on her pulse point. "That door opens, I'm done," he said. His voice did not rise. Eyes. That made it worse. "Sir," O'Hara said, stepping closer, "you're threatening staff." Calder's eyes slid to O'Hara. They went flat. "You come closer," Calder said. "And you get hurt." O'Hara hesitated. He had been trained for drunks, for fists, for knives pulled in waiting rooms. He had not been trained for a wounded man whose whole body still moved like a mission. Mara Keene stood by the supply cart, still as a shadow. Her hands were empty. Her face gave nothing away. Her eyes moved between Calder's grip and Shaw's breathing. Then to the monitor, then back to Calder's shoulders. The fluorescent light above them flickered again. Calder flinched at the buzz, a quick twitch at his temple, like a reflex he hated. Shaw spoke without breaking eye contact. "Everyone take one step back," she said. A pause. Then people did it. Calder's breath shuddered. His pupils looked too big in the harsh light. He was fighting for oxygen and fighting for control at the same time, and the effort made sweat bead along his hairline. "Jace," Shaw said, softer, "if you keep pulling lines, your heart will stop. Do you understand me?" Calder stared at her. Something flashed behind his eyes. Not confusion, a memory that moved too fast. He released her wrist. Shaw did not move away. She flexed her fingers once, then held them up where he could see them. Open palms, no instruments. "Good," she said. "Now let us help you breathe." Respiratory brought the mask in again, slow this time, like approaching a skittish animal. Calder's gaze tracked it. His shoulders tightened. "Don't," he warned. "It's oxygen," Evan said, trying to sound normal. Calder's eyes cut to Evan again. "You keep talking," Calder said, "like you've never had a bag over your head." Evan went silent. The mask hovered a few inches from Calder's mouth. Calder's throat worked. He swallowed. The next breath he took sounded wrong, thin, wet, as if something inside his chest was collapsing in on itself. The monitor answered with a drop in oxygen. The rhythm stayed fast, frantic, but there was a new wobble to it. Shaw glanced at the screen, then at the wound. "Right side is failing," she said. Calder heard the words. His gaze snapped to her face. "Don't cut me," he said. "It will save you," Shaw replied. Calder shook his head once. Small, fierce. "That's how you make a body quiet," he said. A nurse sucked in a breath. She did not mean to make loud. Shaw's eyes tightened. "Who is after you?" Calder's jaw jumped. He did not answer. He looked again at the blinds and the strip of corridor. O'Hara shifted his weight. His hand went toward the restraint kit on the wall. Calder saw it. His body moved before anyone else could. He drove his heels down, shoved with his legs, and the bed slammed again against the bumper. An ivy pole tipped and clanged to the floor. A bag of saline swung, slapped the rail, and burst a spray that glittered under the light. "Enough," Shaw snapped. Calder's gaze locked on O'Hara. "If you strap me," Calder said, each word clean and deliberate, "I'm gone. I will crawl out of here bleeding. I will not be taken in this room." Calder held Shaw's gaze as if the room had narrowed to a single point between them. His chest rose in uneven pulls. His right side still lagged stubborn and small, like a door that would not open. No one spoke for a beat. The monitor kept chirping, fast and angry. The smell of spilled saline mixed with antiseptic and blood clean and dirty at once. Officer O'Hara took another step toward the wall kit. Shaw's voice cut through the noise. "Nobody straps him." O'Hara paused. "Doctor, he is threatening staff." "He is bleeding out," Shaw said. "He is hypoxic. If you escalate, he codes." Calder's eyes flicked to the restraint kit anyway. He had seen it. His fingers flexed on the rail. The tendons stood out like wire. Evan swallowed. "We can sedate. Ketamine low dose keep airway." Calder's head snapped toward Evan. "No!" It was not shouted. It was worse than shouting. It sounded like a line drawn. Respiratory stood frozen with the mask half lifted, waiting for someone to decide the room's shape again. Shaw looked from Calder's face to the gauze at his flank. Blood was creeping outward under fresh layers, darkening the fabric in slow blooms. She measured his breathing with her eyes, not her ears. Then she noticed something small. Calder's pupils were tracking the ceiling light. Not the people, not the door, the light. The fluorescent fixture flickered again, a quick stutter that made the hum sharpen. Calder flinched. The flinch was fast and contained like a crack in armor that immediately sealed itself. Mara Keene moved. She did not announce herself. She did not rush. Her shoes barely whispered on the tile. She rolled the supply cart closer with one hand, stopped it, and set both palms on its edge for a moment, steadying it as if it mattered. Shaw turned her head. "Keene, out." Mara's eyes did not leave Calder. "Doctor." "Not your bay," Shaw said louder now. "Get out!" Mara nodded once, calm and obedient in the face, disobedient in the feet. She stepped closer to the bed anyway, careful, angled slightly to Calder's left, where his injured side could not swing toward her as easily. Her hands stayed visible, empty, no clamps, no needles. Calder watched her approach. His jaw tightened, but his grip loosened by a fraction, like his body was arguing with itself. "Stop," he warned. Mara stopped. She did not stop far away. She stopped at a distance that said she was not afraid, but not challenging either. Her voice was low-built for one person. "You are not being taken." Calder's eyes narrowed. "You do not know that?" Mara glanced once at the glass wall and the half-raised blinds. The corridor beyond was empty. White. Too bright. Her gaze returned to Calder's face. "I know you cannot breathe," she said. "I know you are trying anyway." Shaw stepped forward, irritation sharpening her words. "Keene," I said out. Mara kept her voice level. "He is listening to the wrong thing." Evan blinked. "What does that mean?" Mara's eyes flicked to the fluorescent light. It buzzed again. Calder's throat tightened with it. His shoulders rose as if bracing for impact that did not come. "He is tracking the flicker," Mara said. "It is pulling him somewhere else." Shaw's expression tightened. "This is not a psych consult." "It is not psych," Mara replied. "It is physiology and memory at the same time." Calder's breathing hitched. His eyes stayed on Mara now, but the tension did not leave his hands. He looked ready to tear the room apart if it touched him again. Shaw exhaled through her nose. Keene stepped back. Mara's gaze held steady on Calder. "If you want him still, you need his consent." O'Hara let out a short laugh of disbelief. "Consent. He is threatening to crawl out." Calder did not look at O'Hara. He looked at Mara. "You talk like you know me," he said. Mara's face did not change. "I talk like I know what men do when they think a bag is coming." Evan flinched at the word bag. He did not ask why. Calder's mouth opened, then closed. His grip on the rail tightened again. Sweat ran down his temple and disappeared into his hair. Shaw's patience thinned. He needs oxygen and access. Keen, you are interfering with care. Mara turned her head slightly toward Shaw, not taking her eyes off Calder. Give me 10 seconds. You do not have 10 seconds, Shaw said. Mara's voice stayed quiet. 10 seconds is cheaper than restraints. Shaw stared at her. The room waited. Even the monitor felt louder in the pause. 10, Shaw said, clipped. Then I take over. Mara nodded once. She stepped closer, slow. Calder's muscles bunched. His elbow moved an inch, testing distance. Mara stopped again, then lowered herself, so her eyes were level with his. She did not lean over him like an owner. She placed herself beside the bed rail, shoulder to his left, where he could see her, without twisting his injured side. Look at my hands, she said. Calder's eyes dropped just once to her fingers resting on the rail. They were steady. No tremor, clean nails, no rings. Now look at my face, Mara said. Calder did. His stare was sharp, suspicious, searching for the hook beneath the kindness. You are here, Mara said. You are on a bed. You are not on concrete. Calder's nostrils flared. He took a breath. It caught. The light flickered again. Calder's eyes jumped upward. Mara lifted one hand slow and placed it between his line of sight and the fixture. Not blocking completely, just breaking the pattern. Stay with me, she said. Calder's gaze snapped back to her. His jaw worked. Pain flashed across his face, quick and ugly, then vanished behind control. Shaw watched, unwillingly interested. Mara spoke again, even quieter, the words shaped like a code, but sounding like comfort. In, hold, out. Calder's chest rose. It rose unevenly, but it rose. Mara counted with her eyes, not her mouth. Her hand stayed lifted, giving him something to look at that was not the ceiling. His breathing slowed by a fraction. The monitor's screaming pitch softened into a steadier rhythm. Not safe, just less chaotic. Shaw's gaze moved to the pulse oximeter, then back to Calder. Oxygen, she said to respiratory, less forceful now, slow. Respiratory approached with the mask cautious. Calder's attention flicked to the mask. His hands tightened again. Mara's voice did not rise. Do not fight the mask. Fight the air. Calder stared at her. Who are you? Mara did not answer the question the way the room expected. She did not offer a name from a badge. She did not explain. She shifted closer, close enough that only he would hear, and her voice changed. It dropped into a register that carried something old. 6 words, clean and precise, brushed his ear. Cinder, eyes on me, stay. Calder froze. Not relaxed, not softened. Stilled? His pupils widened, as if the world had split open and shown him a face he had buried. His grip on the rail loosened, not from weakness, but from recognition. His mouth moved without sound. Then a whisper broke out, ragged and disbelieving. No, he swallowed hard. That cannot be you. No, he whispered again, as if the word could push her back into the ground. That cannot be you. Mara did not pull away. She stayed close enough for him to hear her without forcing his ribs to twist. Her eyes held his like a steady point on a map. It is me, she said. Stay with me. Calder's throat worked. His gaze searched her face with a kind of disbelief that looked almost like anger. Not at her, but at the universe that had put her here under bright lights and cheap scrubs. You were gone, he said. The words scraped out of him. You were listed. Evan Miles looked from Calder to Mara's badge, like the badge might explain it. Listed as what he asked before he could stop himself. Dr. Shaw shot him a look that said not now. But the question was already in the air. It hung there with the smell of blood and antiseptic. Mara's expression did not change. Her voice stayed low, made for one person. Breathe, she told Calder. Calder dragged air in. It went down hard, then caught. His right shoulder lifted late again. His eyes flicked toward the ceiling light, and Mara's hand rose, breaking the flicker in his line of sight. The simple gesture steadied him more than any command. Shaw watched the monitor, then watched Mara. A small shift in the room happened without anyone naming it. People stopped moving like this was just another trauma. They started moving like they were in a room with a story they did not have clearance to hear. Calder's gaze stayed locked on Mara. His voice dropped rough with pain and something else. How are you still here? Mara held his stare. You are bleeding. That is not an answer, Calder said. Mara's mouth tightened, not from guilt, from restraint. It is the only one you get right now. Shaw stepped closer. She kept her tone controlled, but her eyes sharpened. Keen. Explain. Mara did not look away from Calder. Doctor, he needs air before he needs explanations. Then get out of the way so we can treat him, Shaw said. Mara's gaze lifted to Shaw for the first time. It was calm. It was not soft. You are treating what you can see, she said. He is fighting what he can feel. O'Hara made a sound like he wanted to protest, then swallowed it. He watched Calder's hands ready for another swing. Respiratory hovered with the oxygen mask. This time Mara held up 2 fingers, a small signal. Slow, careful. Respiratory moved in, not like a technician, but like a person approaching a dog that had been hit too many times. Calder's eyes tracked the mask. His shoulders tensed. Mara leaned in just a fraction. "Let it sit on your face," she said. "No straps, no hands." Calder's jaw clenched. He stared at her, then at the mask. His breath shuddered, then he nodded once. Small, reluctant. Permission that looked like surrender until you saw the effort it took. The mask settled over his mouth and nose. Oxygen hissed. The sound was thin and steady like a quiet promise. Calder inhaled. His chest rose unevenly, but it rose. His eyes fluttered once, then sharpened again, refusing to leave her. "Cinder," he said, tasting the word like a wound. "They told me that name was buried." Mara's face stayed still. Only her eyes gave a flicker, like a door closing carefully. "Do not say it loud." Evan's brow furrowed. "Cinder," he repeated under his breath, as if the syllables might turn into an acronym if he stared long enough. Shaw cut him off. "Miles. Focus." Evan nodded too fast. He brought the ultrasound closer, then paused, uncertain. His gaze went to Shaw, then back to Mara. He did not know who was in charge anymore. That confusion made his hands clumsy. Calder's gaze left Mara for the first time and moved to the glass wall. The blinds were still half raised. The corridor beyond was bright empty and too open. His fingers tightened on the rail. "They were waiting," he said. Shaw leaned in. "Who?" Calder did not look at her. "Not the kind you put in a report." Shaw's mouth flattened. "You are in my trauma bay. If there is a threat, I need to know." Calder's eyes returned to Mara. "You hear the way she talks," he said, voice tight. "You think she is just a nurse." Mara did not correct him. She checked his pulse with her eyes, watched the way the oxygen line trembled with each breath. Shaw's patience thinned. "Keen, I am asking you directly. Do you know this patient?" Mara's answer was careful. "I know what he is." Calder gave a short, humorless exhale into the mask. "And I know what she is?" The room went quiet. Even the beeping felt like it had pulled back. Shaw shifted her stance, planting her feet. "What is she, Calder?" Calder swallowed. His throat bobbed, then he winced. His right side protested a deep ache that made his eyes water for a second. He blinked it away. "She patched me on a roof in the dark," he said. "She did it with one hand because the other had a rifle sling wrapped around it." Evan stared. "You are delirious." Calder's eyes cut to Evan, sharp enough to shut him down. "I know delirious," he said. "This is not it." Mara's gaze flicked to the wound at his flank. Blood had soaked the gauze again, creeping outward in slow, deliberate circles. The pattern of that spread mattered to her in a way it did not matter to the others. Shaw followed her eyes. "We need to expose and reassess," she said. Calder stiffened, but Mara's hand rose again, not touching him, just anchoring his attention away from panic. "Let them look," Mara said. "No straps, no hands on your wrists." Calder's jaw worked. He nodded once more. Permission again given, like a man handing over his weapon for inspection. Shaw signaled, and the team moved in careful. Gauze came off in layers. The wound beneath was ugly, but it was not messy. The tissue bruising had a strange curve to it, as if pressure had wrapped around bone instead of splintering it at random. Evan's voice came out quieter. "That is, focused." Shaw did not answer him. Her eyes narrowed, reading what she could. "Blast lung," she murmured. "And something else." Calder watched Mara's face, not the wound. "You see it," he said. Mara did not speak. "You have seen that pattern," Calder pressed. His voice cracked on the last word. "Pain, yes. Also recognition that came with grief." Mara's nostrils flared once. It was the smallest sign of strain. She looked up at him. "Breathe." Calder took a breath, then another. The oxygen helped, but his body still fought the memory beneath his skin. His fingers flexed again, then settled. "They burned the perch," he said softly. Shaw frowned. "Perch." Calder's eyes stayed on Mara. "Rooftop nest," he said, and the term came out clean like a report. "We used it for Overwatch. They knew the exact spot." Mara's hand stopped midair for a heartbeat. Not a full flinch, just a pause, as if someone had tapped her shoulder from behind. Shaw saw it. Her gaze sharpened. "Keen," she said. "What are we dealing with?" Mara lowered her hand slowly. Her voice stayed quiet. "A directed charge," she said. Evan blinked. "How can you tell without imaging?" Mara did not look at him. "Because it does not fan, it guides." Shaw stared at the wound again. "That is an inference." Calder shook his head, a small movement that still made his ribs complain. "It is not," he said. "It is a signature." The word landed in the room like a heavy object. Signature. Not accident, not random, not bad luck. O'Hara glanced at the door. He took a small step back as if he suddenly remembered the walls were thin. Calder's breath came a little easier now, but his eyes were bright with a different kind of strain. "They timed it," he said. "Window shifted last minute. Only a few had that update." Shaw's voice softened without losing its edge. "How many?" Calder's gaze did not move from Mara. "5," he said. Mara's eyes narrowed by a fraction. She did not ask why 5. She did not need to. A number like that carried weight in her bones. Calder's voice dropped lower. They were waiting above, he said. Roofline. Exact time, exact angle, exact time, exact angle. Calder said it like he could still feel the grit on his teeth from the blast, like the roof was still above him, even here, even now. The oxygen mask fogged faintly with each breath. It helped, but it did not erase the tightness in his right chest. It only made the struggle quieter. Dr. Shaw held her voice steady. 5 people had the update. That is what you are saying. Calder's eyes stayed on Mara. 5, he repeated. Mara did not ask who, not yet. She watched the way his ribs moved, left side lifting clean, right side late, shallow, stubborn. She watched the pulse on his neck, fast, tired, fighting. Evan hovered near the ultrasound, caught between curiosity and fear. That sounds like sabotage, he said, then tried to make it clinical, or a misunderstanding. Calder's gaze cut to him. Misunderstanding does not place a charge on a roof. The word charge landed wrong in the room. It turned equipment into props. It made the ceiling feel lower. Shaw nodded once more to herself, then to anyone else. We are not debating motives, she said. We are keeping you alive. She turned toward the nurse at the workstation. Portable chest film, now. Then CT. I want a full scan. Mara's eyes lifted. No. It was not loud. It was not rude. It was final enough that the room paused around it. Shaw looked at her. Excuse me? Mara kept her attention on Calder's breathing. If you send him to CT before you relieve the pressure, he is going to fold on that table. Evan blinked. Fold. Mara finally looked at Shaw. The calm in her face did not soften. His right lung is fighting a cavity that is closing on it, she said. You lay him flat and roll him through a hallway, that cavity wins. Shaw's jaw tightened. You do not know that. Mara nodded once, like she accepted the challenge. I do. Shaw glanced at the monitor. Oxygen had climbed a few points and held. Heart rate was still too high. Blood pressure was still slipping. The wound was still leaking in slow, deliberate pulses. Keenshaw said, You are a night shift nurse. I appreciate your concern. Step back. Mara did not move. She did not block anyone. She simply stayed where she was, between Calder's attention and the ceiling light that kept flickering. Calder's voice rasped under the mask. She is right. Shaw turned to him. You cannot possibly know that. Calder's eyes did not leave Mara. I know what that pressure feels like. I know what happens when you get moved wrong. His fingers tightened on the rail. I watched it happen. The silence that followed was not respectful. It was wary. Evan tried again, softer. We have to image to know what we are dealing with. We could miss internal bleeding, a lacerated spleen, a vascular tear. Mara answered without looking at him. You can miss a lung that collapses while you are trying to take a picture of it. She leaned closer to the wound and pointed not with a finger, but with her eyes. Look at the bruising pattern, she said. Shaw crouched slightly and stared. The tissue around the injury was purple and green in bands that curved instead of spreading. It was not the blotchy chaos of a blunt impact. It looked like pressure had wrapped around ribs and squeezed. Evan murmured, That is not normal. Mara lifted the corner of the dressing, gentle. Blood oozed, but the fragments beneath were not jagged in all directions. They clustered. They followed a path. It looked wrong in a way that made your stomach tighten. That is too clean, Evan whispered. Calder's eyes closed for half a second. When he opened them again, the steel was back. They built it to look like war, he said. War is easy. War is noise. This was quiet. Shaw stared at him. You were telling me this was a targeted device. Calder nodded once slow, on a rooftop nest, not a convoy, not a street, not random. Mara's breathing stayed even, but something behind her eyes went sharper. A memory did not surface fully. It only tugged, a small pull that made her shoulders tighten for a heartbeat, then release. Shaw noticed. Keen, she said again. How do you recognize this? Mara's gaze stayed on the wound. Because it has geometry. Evan frowned. Injuries do not have geometry. Mara looked at him then. Her expression was not unkind. It was tired. Some do, she said. Some are drawn. Shaw's voice hardened. We are not doing poetry here. Mara's eyes returned to Calder. He is bleeding through 3 layers, she said. His breathing is asymmetrical. He has blast lung. You can hear it. You can see it. You can watch the right side fail. Respiratory shifted uneasy. His breath sounds are diminished on the right, they admitted. Shaw exhaled once. Fine. We can place a chest tube here, stabilize, then move. Mara shook her head. Not a full tube yet. Shaw stared. Not yet. Mara kept her tone clinical. Decompression first. Needle. Quick. You buy space. Then you decide tube and imaging. Evan looked at Shaw, waiting for the normal hierarchy to snap back into place. He wanted rules. He wanted the comfort of someone being clearly in charge. Shaw's eyes stayed on Mara. Where did you learn blast medicine? Mara did not answer immediately. Her gaze flicked up to the fluorescent fixture as it buzzed again. Calder's eyes twitched toward it. Mara lifted her hand, breaking the line of sight, and Calder's focus returned to her without a fight. Shaw saw the exchange. It was small, but it was intimate in a way that did not belong to strangers. Where Shaw repeated. Mara finally spoke, and the words were careful. Not in school. A ripple of discomfort moved through the team. Evan tried to make it a joke and failed. Lots of things are not in school. Mara's eyes went to him, then past him to the glass wall and the corridor beyond. The blinds were still half raised. The hallway light was too bright. The sound of the hospital outside was distant, muffled. She looked back to Calder. Calder swallowed. Someone burned my perch, he said. Before we even cleared comms. Shaw's brow furrowed. Cleared comms. Calder's gaze stayed fixed, unwilling to let go of the one person who felt real in the room. We had sealed coordinates, he said. Then the window changed. Then the roof blew. His voice tightened. The charge did not scatter. It chased. Evan's mouth went dry. Chased. Mara nodded once, almost imperceptible. Directed, she said. Shaw's face was controlled, but her eyes sharpened with a new kind of attention. If that is true, she said, then we have an active threat. Calder's eyes flicked to the corridor again. Threats do not announce themselves. O'Hara shifted his stance near the door. For the first time, his hand moved from the restraint kit to his radio, then stopped uncertain. Shaw turned back to Calder. Listen to me. We are going to treat you here. Nobody is taking you anywhere. Calder's breathing caught. The mask fogged, then cleared. You cannot promise that, he said. Mara's voice came in quiet but precise. Doctor, she said. He is not resisting care. He is resisting surrender. Shaw stared at her. The phrasing was too exact, too practiced. Evan looked down at Mara's hands. There was a pale line across her knuckle, an old scar that did not belong to hospital work. Another faint mark near her wrist, half hidden by the cuff of her scrub top. He looked away quickly, as if he had seen something private. Shaw's focus returned to the wound. Her medical instincts wrestled with her pride and lost. All right, Shaw said. Decompression, all decompressions first. Evan let out a breath he did not know he had been holding. I will get the tray. Mara's gaze snapped to him. No. Evan froze. No. Mara's voice stayed even. Not your hands, she said. Not yet. Shaw's eyes narrowed. Keen, that is enough. Mara did not argue. She gave Shaw the facts again, stripped of emotion, stripped of story. You scan him too deeply without relieving the pressure, she said. You roll him flat, his right lung folds in on itself. You roll him flat, his right lung folds in on itself. The words landed with the kind of certainty that made people hate you for being right. Dr. Shaw stared at Mara, then at Calder, then at the monitor. Oxygen hovered in the low 90s and kept trying to fall. Heart rate still hammered. Blood pressure sagged and rebounded, like a tired boxer refusing the mat. Needle decompression is not a nursing call, Shaw said. Mara did not flinch. It is a breathing call. Evan's hands hovered over the tray, like he wanted to be useful without being wrong. Doctor, we can do a quick portable chest film first. Confirm pneumothorax. Mara's eyes cut to him. You want confirmation while his lung collapses. Shaw's jaw tightened. Keen, you are out of lane. Mara's voice stayed low, controlled. Then put me back in it. The room went still in a new way. Not shock, but attention. Even Officer O'Hara stopped looking for a reason to use his cuffs and started looking for a reason to leave. Calder shifted his head against the pillow, the mask hissing softly. She is right, he rasped. Do it here. Shaw's eyes flicked to Calder. You need to stop directing your care. Calder's gaze held hers. There was no pleading in it, only a hard line. I am not directing, he said. I am refusing to be pinned. Evan swallowed. Pinned. Calder's fingers flexed on the rail, then steadied. That is what it feels like, he said. Flat, strapped, quiet, then gone. Shaw inhaled slowly, as if pulling her own temper back into her chest. She looked at Mara again. If you are so certain, explain. Mara leaned closer to the wound without touching it. Her eyes tracked the bruising curve again, the clustered fragments, the way the tissue had been driven inward with intention. His right side is under pressure, she said. He is breathing like he is climbing stairs with one lung. His oxygen keeps dropping, even with supplementation. You can hear diminished sounds, and you can see the lag. If you move him supine and you let that pressure keep building, he loses what little expansion he has left. Shaw's face did not soften, but something in her eyes shifted, a doctor recognizing a pattern. Not the war behind it, just the physics. Respiratory nodded reluctantly. Breath sounds are poor on the right, they said. He is working too hard. Shaw looked at the nurse near the med station. Call for the decompression kit, she said. Then after a beat, and bring the chest tube tray. We may need both. Evan exhaled. It was small, but it carried relief. O'Hara tried again, quieter this time. Doctor, he is still a security risk. Shaw did not look at him. He is a patient. Calder's eyes slid past Shaw toward the glass wall. The corridor beyond had changed. It was subtle the way weather changes. The same light, the same tile, but the air felt different. Two men stood on the other side of the trauma bay glass. No scrubs, no stethoscopes, no visitor stickers. Their suits were charcoal dry despite the rain outside. Their posture was not rushed or curious. It was still as if they had been placed there and told to hold. Evan followed Calder's gaze and stiffened. "Who are they?" he whispered. No one answered. Nobody could not, honestly. Shaw glanced over her shoulder and saw them. Her mouth tightened. She took 2 steps toward the glass, then stopped before she looked like she was approaching a problem she could not chart. O'Hara shifted closer to the door, protective now, as if the threat had moved from the bed to the hallway. "I can ask them to step back." Mara did not turn around. She did not need to. The muscles at the back of her neck tightened for a heartbeat, then released. Calder's voice dropped rough under the mask. "They do not step back," he said. "They wait." Shaw's tone stayed professional, but it was thinner. Keen. "Do you know those men?" Mara's eyes stayed on Calder's breathing. "Not by name." "Then how do you know what they do?" Shaw pressed. Mara's voice was quiet. "Because they are not looking at him." Evan blinked and looked again. The suits were not watching Calder's chest rise and fall. They were not watching the nurses move. Their focus was fixed, almost gentle, on Mara's position by the bed. A chill ran through Evan that had nothing to do with the air conditioning. Shaw turned toward the glass and lifted her chin. She could not see their eyes well through the reflection, but she could feel their attention. She raised a hand in a gesture that asked a question without words. Neither man moved. Behind her, the fluorescent light flickered again. Calder's eyes jumped reflexive. Mara lifted her hand and broke the line of sight. Calder's breathing steadied by a fraction. That tiny exchange happened and ended in the space of a heartbeat. One of the suits raised a phone to his ear. The other did the same. Shaw looked at the ceiling speaker as it clicked softly, a barely audible pop before an announcement. The intercom crackled. "All personnel," a calm voice said, "too calm, security protocol is active for the South Wing. Remain in current stations." Shaw's head snapped toward the hall. What she said more to the room than to anyone. Evan's eyes widened. "Security protocol," he repeated. O'Hara's radio chirped once, then went dead. He stared at it and pressed the button again. "Nothing," Dr. O'Hara said, voice tight. "My channel is blocked." Shaw's nostrils flared. "That is not possible." Mara finally turned her head just enough to look at the glass wall. The blinds hung half-raised, and the suits were framed by that narrow band of visibility like faces behind a slit in a file folder. The blinds moved. They did not drop fast. They lowered in a smooth, motorized glide until only the upper third of the corridor was visible. Then they stopped as if someone had decided exactly how much the room was allowed to see. Black bars and white light. Shaw stared at the blinds, then at the ceiling. Who ordered that, she demanded. No one answered. Calder's breath fogged the mask again. When he spoke, his voice sounded scraped, raw. "They always close the world when they arrive." Evan looked at Shaw. "Doctor, should we move him?" he asked. Then hated himself for asking because it sounded like surrender. Shaw's eyes stayed on the blinds. "No one is moving him until I say." So she snapped, then forced her voice down. "We are a hospital. This is my bay." Mara's gaze returned to Calder. "Keep breathing," she said. Calder's eyes did not leave her. "They are not here for me," he whispered. Shaw's attention snapped back. "What does that mean?" Calder swallowed, the motion painful. His hand reached toward Mara's wrist, not grabbing this time, just touching lightly, like a man checking if the floor was real. "They timed the blast," he said. "Not to kill me fast, to get me here." Evan's voice came out small. "Why would anyone do that?" Calder's gaze flicked to the blinds again. His pupils tightened. "Because I would not stop fighting until someone I trusted told me to." Shaw's eyes cut to Mara. Mara did not react. Her face remained calm, but the air around her felt tighter, as if the room had closed a fraction. A nurse at the workstation spoke up, voice trembling. "The doors," she said. "The South Wing doors just locked." Shaw stepped toward the threshold and tried the handle. It did not give. She swiped her badge. A red light blinked once and stayed red. "That is not possible," Shaw said, again, but her tone had lost its certainty. The ceiling speaker clicked, then spoke a second time. "Military liaison entering the South Wing. All personnel remain in current stations." Evan stared at the locked door. The word military did not calm him. It did the opposite. O'Hara moved closer to Shaw, instincts scrambling for a chain of command he could recognize. "Doctor! He said this is above us!" Shaw's eyes flashed. "Nothing is above a trauma code in progress." Mara's hands stayed steady as she adjusted the oxygen flow. Calder's breathing was still uneven, but it was present. He watched her face like it was the only stable thing left in the room. "They will ask for the survivor," Calder whispered. Shaw turned back sharply. "Who will?" Calder's mouth tightened. The answer seemed to cost him more than pain. "The ones who do not wear badges," he said. The blinds lowered another inch, almost casual. and the south wing went quiet in a way that did not belong to a hospital. The quiet settled wrong. It was not the hush after a code, not the lull between alarms. It was a held breath that belonged to someone else. Dr. Shaw stood at the locked door for one more beat, palm flat against the push bar, as if pressure alone could convince it to cooperate. The red light on the reader stayed red. The overhead speaker gave no more explanation. The corridor beyond the blinds looked bleached out, a strip of white that did not feel like safety. She turned back to the bed. Calder lay there with the oxygen mask hissing softly, eyes open and fixed. He was calmer, but not relaxed. His hands still gripped the rail as if it might be the last solid thing in the room. Each inhale lifted his left side. The right side followed late like a door that could not swing all the way. Mara Keene stood at his left shoulder. She kept her posture loose, but her attention was tight. She watched his skin tone, the way sweat gathered at his hairline, the way his lips held a faint blue tint that came and went with his breathing. She watched the monitor the way soldiers watch wind. Shaw moved in, voice-controlled. "We do the decompression, now." Evan Miles nodded too quickly and reached toward the cart. "I will prep the needle." Mara's eyes flicked to his hands. "Stop." Evan froze. "What?" Mara did not raise her voice. "You are shaking." "I am not," Evan said, then looked down and realized his fingers were not steady. Shaw's gaze sharpened. Miles stepped back. Evan swallowed and did cheeks burning under his mask. He hated the feeling of being corrected in front of everyone. He hated that the correction felt justified. Shaw looked at Mara. "You call the site. You talk me through it." Mara did not smile. She only nodded once. Her hands went to the tray with a familiarity that did not belong to a hospital kit. She snapped open packaging with a clean practice motion. The plastic crackled. The smell of antiseptic rose sharp and cold. Calder watched her hands. "Do not touch my wrists," he said. Voice rough through the mask. Mara met his eyes. "I will not." "Do not put me flat," he added. Shaw opened her mouth to argue, then stopped. She glanced at his breathing again, the lag on the right. She adjusted her plan in her head and did not announce it like a concession. "We will keep you angled," she said. "You need to hold still." Calder's jaw worked once. Pain flashed in his eyes. Then he nodded. Shaw signaled to the team. "Raise the head. Slight roll to the left. Keep him supported." Two nurses moved in slowly, hands visible, careful. They adjusted the bed and slid a pillow under Calder's right shoulder to keep pressure off his injured side. He tensed, then held. The light overhead flickered. Calder's gaze snapped up reflex like a snapped leash. His grip tightened. Mara lifted her hand between his eyes, and the fixture breaking the line. Her voice stayed steady. "Look at me." Calder's eyes returned to her. His breathing hitched, then resumed. Shaw saw it. She did not comment. She simply took advantage of the moment of stillness. "All right," she said. "Clean and fast." Mara swabbed the skin with antiseptic broad strokes, firm enough to anchor, gentle enough not to startle. The scent bloomed sharp and medicinal, and for a second it drowned out blood. Calder's nostrils flared. His fingers flexed on the rail. "Talk to me," Shaw said, meaning the procedure, but also meaning everything else. Mara's voice stayed clinical. "Second intercostal space mid-clavicular line," she said, then paused and corrected herself with a tiny shift of her eyes. "No, better here. He is not a textbook. Go higher on the chest wall line. Avoid the bruising. You want the pocket." Shaw stared at the mark Mara indicated. "How do you know there is a pocket?" Mara did not look up. "Because he is fighting for air and losing on the right." Calder watched Mara's face. "You see it," he murmured. Mara did not answer him. Her focus narrowed to skin rib space. Shaw took the needle. She held it up so Calder could see it, then lowered it near the site. Calder's shoulders tightened. "Hold." "Oh." His voice turned flat. "If you miss, I will not," Shaw said. Calder's eyes flicked to Mara. "On whose count?" Mara leaned closer just enough for him to hear. "On mine." Shaw's brows lifted, but she did not object. She had already crossed into the part of the night where pride cost too much. Mara placed two fingers lightly on Calder's left shoulder, not pressing, not restraining a point of contact that said, "Stay here." Her other hand hovered ready to block the flicker if it returned. "Breathe in," Mara said. Calder inhaled. The mask fogged. "Hold," Mara said. His chest held at the top uneven. "Now," Mara said. Shaw inserted the needle. There was resistance, then a sudden give. A thin hiss escaped, quick and unmistakable. Trapped air finding an exit. The sound was small, but it changed the room. Every person heard it and understood it without training. Calder jerked once more from surprise, then pain. His eyes widened. Mara's fingers stayed on his shoulder. "Out," she said. Calder exhaled. The hiss continued for a heartbeat, then softened. His next inhale came deeper. It still caught on the right, but the catch loosened like a fist, unclenching one knuckle at a time. His color, a nurse whispered. Shaw glanced at the monitor. Oxygen climbed. Not dramatic, just up steady holding instead of falling. Respiratory leaned in and listened. Breath sounds, they murmured, then nodded. Better. Evan stared at the needle like it was magic and hated himself for thinking that. It was not magic, it was timing anatomy, and someone who knew what panic sounded like without calling it panic. Calder's shoulders lowered a fraction. His grip on the rail eased, not releasing, but loosening. Mara watched his eyes, the hard shine in them dimmed by a degree. Not trust, recognition. You are still here, she said. Calder swallowed. His voice came out hoarse. So are you. Mara's face did not change. She adjusted the oxygen flow with 2 precise turns and checked the needle placement again. No wasted motion, no trembling hands. Shaw exhaled slow. Relief tried to rise in her chest, and she pressed it back down. Relief made people sloppy. All right, Shaw said. Chest tube tray. We stabilize fully, then imaging. Mara did not argue that time. She simply watched Calder's breathing and waited for the right moment to push further. Her calm was not passive. It was strategic. Calder's eyes drifted to the blinds again, but his head did not turn. He seemed to be measuring the room with his peripheral vision. They closed the world, he said softly. Shaw glanced at the glass wall. The blinds still sat at that precise height, allowing just enough visibility to feel watched and not enough to feel safe. The 2 suits were still there. Their silhouettes did not shift. Their phones were down now, hands at their sides, patient as tide. Shaw's voice sharpened. This is a medical facility. We need to know who initiated the lockdown. No response came from the hallway. No response came from the ceiling speaker. The hospital outside the bay was muffled, like someone had turned down the volume on normal life. O'Hara stepped closer to Shaw, voice low. Doctor, I am telling you, this is not our security doing this. Shaw did not look at him. Her eyes stayed on the suits, through the narrow strip of visibility. Then whose? O'Hara's throat moved. I do not know. Evan pulled his gaze away from the glass and back to Calder. If this is a threat, he said, trying to sound like a doctor again, we should call the police. Calder gave a small shake of his head, the movement shallow so it would not hurt. Police do paperwork, he said. These people do erasing. Evan's mouth opened, then closed. He looked at Mara, then away, as if he could not decide whether to believe what he was hearing or be offended by it. Shaw took a step toward Calder, lowering her voice. Calder, I need specifics. Who placed the device? Calder's gaze slid to Mara again. He did not answer Shaw directly. 5 people had the update, he repeated, as if that was the only safe truth in the room. Only 5. Mara's eyes narrowed slightly. Window change, she said. Calder nodded. Last minute. Mara's jaw tightened at the edge, a tiny muscle tic that vanished quickly. She checked the wound dressing again and pressed fresh gauze into place, firm enough to help, gentle enough not to trigger him. Shaw noticed the tic. Keen, she said quietly, how do you know what this looks like? Mara did not look up. Because it is deliberate. That is not what I asked, Shaw replied. Mara's hands stayed steady. She taped the gauze down with short strips, clean lines. She kept Calder's attention on her voice, not on the sensation. You do not learn this from charts, Mara said at last. Shaw stared at her for a beat. The implication sat between them. Past. Something classified. Something that made those suits stand still in a hallway and wait. Calder's breathing grew more even. Not normal, but better. He shifted his head slightly on the pillow, eyes never leaving Mara's face. They burned my perch, he said, voice raw. They wanted it to look like collapse, like bad luck. Mara's eyes lifted to his for a second. In that look, something old moved fast as the flicker in the light. Calder saw it and pushed careful. You have seen that kind of burn. Mara's expression stayed flat, but her voice lowered. Do not talk about it here. Shaw heard the change in tone. So did Evan. The room had moved again, deeper into something it could not file. Outside the glass, one of the suits shifted his stance for the first time. Not a step, just a weight transfer, like someone settling in for a longer wait. Then the service elevator down the hall chimed. A single clean sound that cut through the hum of machines. Ding. Mara's eyes flicked toward the door for half a second, and in that brief motion, her calm did not break, but it hardened. Ding. The sound came from the service elevator down the hall, clean and bright, like a coin dropped into an empty cup. It did not belong to a trauma bay. It belonged to supply runs and linen carts. It belonged to normal. Mara's eyes moved first. Just a flick. Door, ceiling, glass. Then back to Calder's face as if she could decide where danger lived by watching the way his pupils tightened. Calder heard it too. His fingers curled on the rail again, tendons rising. His breathing stayed steadier than before, but his body went alert in a way no monitor could measure. That is them, he whispered. Dr. Shaw straightened. Who? Calder did not answer her. He kept his gaze on Mara. Do not let them near you. Mara's hands were at the edge of the dressing, checking for new bleed, checking the tape lines, checking the angle of the needle. Her voice stayed low. Keep breathing. O'Hara shifted closer to the locked door and tried the handle again. It did not budge. He pressed his shoulder into it, not hard, not enough to look desperate. The door stayed closed anyway. This is insane, Evan said, and the words sounded childish in the room. Shaw shot him a look, Miles' focus. Evan swallowed. He tried to anchor himself in tasks. He reached for the chest tube tray, opened it, lined the instruments in neat order. Metal flashed under the flickering light. The smell of sterilization rose again, sharp enough to sting the back of the throat. The overhead fixture buzzed, then steadied. Calder's eyes twitched toward it, but Mara's hand rose at once, breaking the line, giving his gaze a place to land that did not drag him back into a roofline memory. Shaw watched that exchange and did not comment. She had questions piling up behind her teeth. She kept them there. For now she needed movement that kept the patient alive. All right, Shaw said. We placed the chest tube. Local anesthetic. Keen hold his attention. Mara nodded once. She leaned closer to Calder. You will feel pressure, she said. Not a strap. Not a handcuff. Pressure. Calder's jaw worked. He stared at her as if searching for the lie. He found none, or at least none he could afford to name. Do not touch my wrists, he said again. No wrists, Mara replied. Shaw prepped the sight-gloved hands steady. Evan held suction tubing and tried not to look at the blinds. Outside the glass, the two suits remained in place. Their faces were not visible, only the clean lines of their shoulders and the pale triangles of their collars. The blinds cut across them like a censorship mark. A faint movement shifted the strip of visibility. Not the suits. The blinds lowering another fraction, smooth and deliberate, until only a narrow band of corridor remained. Black bars narrowing the world. Shaw's mouth tightened. This is unacceptable. No one answered, because no one had the authority to argue with a motor. Ding! The elevator chimed again, softer this time, as if the building had cleared its throat. Then footsteps came. Not running, not hurried. Measured steps on tile that said the person walking did not worry about being stopped. O'Hara's hand drifted toward his belt, then stopped. He had no weapon he wanted to use in a room full of oxygen and fear. He swallowed and stood as if his posture could be a barrier. Shaw lifted her chin and set her voice into a tone she used on administrators. This is a restricted clinical area. Identify yourself. The footsteps slowed, stopped. A shadow crossed the thin strip of corridor, still visible above the blinds. Just the top of a head, then nothing. Whoever it was stood close to the glass, close enough that their presence pressed into the room like weather. Mara did not look at the glass. She kept her gaze on Calder. She could feel the shadow anyway. Calder's breathing faltered for a beat, then returned. His eyes stayed locked on Mara's, and his voice came out hoarse. They found you. Mara's expression stayed controlled. Only the skin around her eyes tightened, a barely visible pull. Shaw signaled Evan. Continue, she said, and turned toward the door. She tried her badge again. Red light. She tried a different angle, as if that could change the answer. Red light again. Openshaw said into the air to the speaker to the building. This is Dr. Shaw. I have an unstable patient. Open this door. No response. The ceiling speaker remained silent, as if it had decided it was finished talking. Shaw stepped back, anger rising. This is a hospital, she said louder now. You cannot lock us in. A soft click answered her. Not from the door, from the wall near the glass where the blinds control sat. The blinds lifted an inch. A narrow slice of corridor opened, enough to see a third suit. He stood between the other two like he belonged there. His hair was neatly cut. His shoes were too clean for a hallway that smelled faintly of bleach and wet coats. He held no folder, no visible badge. His hands rested at his sides, relaxed. His eyes were on Mara. Not Calder, not Shaw, Mara. Evan's breath caught audibly. He clamped his mouth shut and looked back down at the instruments, pretending he was not scared. Shaw stepped closer to the glass. Sir, she said, voice clipped. State your name and your purpose. You are interfering with medical care. The man's gaze slid to Shaw, polite, almost respectful. He gave a small nod that was not quite a greeting. Doctor, he said. His voice carried through the glass, calm and dry the way some people spoke when they were about to explain a policy. Then his gaze returned to Mara. The blinds lifted another inch. The two suits behind him did not move. They stayed still as door frames. Calder watched all of this through the corner of his vision, but he did not turn his head. Turning hurt. He kept his face pointed toward Mara, as if looking away might break whatever was keeping him in the bed. Do not look at them, Mara murmured to him. Calder's eyes flicked once toward the glass anyway, then back. I know that voice, he whispered. I hate that voice. Shaw turned sharply toward Mara. Keen, she said low, do you know him? Mara did not answer. She adjusted the dressing one last time, then lifted her hand away, leaving the wound sealed and clean. Her fingers did not tremble. The man outside lifted his hand, slightly palm down, and the blinds rose another inch. It felt like a demonstration, a reminder that the room was not in charge of its own visibility. O'Hara took a step toward the glass, trying to put himself between Mara and the corridor. It was a reflex decent and useless. The man outside did not look at him. He did not need to. The trauma bay door clicked. The lock released. Shaw's head snapped to it. "No," she said, as if she could push the mechanism back with the word. The handle turned from the outside. The door opened. The air from the hallway slid in cooler, carrying the faint smell of rain and something metallic that did not belong to the hospital. The man in the suit stepped into the trauma bay, without asking permission, without hesitating, as if the door had been waiting for him. He did not look around like a visitor. He took in the room in one sweep, the equipment, the blood, the monitor tones, the staff clustered like a defensive ring. Then he looked at Dr. Shaw and nodded once. "Doctor," he said again. Shaw held her ground. "You are in a sterile area," she said. "You need clearance. You need protective equipment." The man's eyes rested on the cap and mask hanging unused on the wall. He did not reach for them. "Understood," he said, and the word meant nothing. Evan's hands tightened around the suction line. His knuckles whitened. O'Hara lifted his chin. "Sir, you need to leave." The man's gaze flicked to O'Hara, brief assessing. Not anger, not threat. The look someone gave a closed gate they already had the key for. Then he turned to Mara. Mara stood very still. Her posture did not change, but the room around her felt tighter, as if all the oxygen had shifted toward one corner. Calder's eyes stayed on her face. "Do not let him say it," he whispered. Mara did not reply. She did not look away from the man. Dr. Shaw stepped in front of the bed, slightly trying to reclaim the shape of the room. "My patient is unstable," she said. "If you have questions, you wait outside." The man's mouth curved into something that was not a smile. "I am not here for the patient," he said. Silence hit like a dropped tray. Evan's throat bobbed. He glanced at Calder, then at Mara, then at the man, and it finally fit together in a way that made his stomach twist. Calder's voice came out raw behind the mask. "You set me up." The man looked at Calder, then as if acknowledging a piece of equipment that had served its purpose. "Your survival was anticipated," he said, and his tone was gentle, which made the words worse. Shaw's eyes flashed. "Anticipated," she repeated. "You are admitting to an attack." The man ignored her question. His gaze returned to Mara, again steady patient. Mara's voice was quiet. "You should not be in my hospital." The man tilted his head a fraction. "On the contrary," he said. "This is the safest place for you, for the moment." Calder made a sound under his breath that could have been a laugh if it had not carried hatred. He tried to push himself up, and pain folded him back. Mara's hand went to his shoulder, instantly not gripping, just anchoring, and he stopped fighting the bed. "Easy," she murmured. He obeyed her voice, not the room. Dr. Shaw saw that too. Her own authority felt like a paper gown in a storm. The man in the suit took one step closer, stopping just inside the bay, far enough to respect the illusion of space. His eyes remained on Mara's face, studying it for a crack that did not appear. Then he spoke her name as if reading it from a file. "Ms. Keene, Ms. Keene." Mara held his gaze without blinking. The fluorescent light above them hummed steady for once, as if it knew better than to flicker in front of him. The air in the bay felt thin, pulled taut between antiseptic and rain and the quiet authority that had just walked through the door. "My name is Mara," she said. The man's expression did not change. His eyes stayed on her face as if he was reading fine print. "You have used many names," he replied. "This one is current." Dr. Shaw stepped forward, shoulders squared. "You are interfering with emergency care," she said. "Identify yourself, show credentials." The man turned his head toward Shaw, polite in the way a person could be while ignoring you. He reached into his suit coat and produced a plain card. No logo, no seal, just a strip of material that caught the light and refused to show detail unless you stood at the exact angle he wanted. Shaw did not take it. She looked at it, then at his face. "That is not hospital clearance." "It is not intended to be," he said. Officer O'Hara made a low sound, frustration and fear braided together. "This is a hospital," he repeated, as if saying it often enough would summon rules that could protect them. The man in the suit glanced at O'Hara again, brief and assessing, then back to Mara. He spoke as if the rest of the room had faded into background noise. "You left without debrief," he said to Mara, "without exit documentation, without reintegration." Mara's jaw tightened. "I resigned." He nodded once. "You disappeared." "I took a job," she said. "I clock in, I pay rent, I work nights because I like quiet." "Quiet is a cover," he said, and his tone stayed even. "You were granted distance. You asked for removal. It was honored." Calder's voice broke through the oxygen hiss. "Grant," he rasped, like she needed permission. The man looked at Calder, as if acknowledging a tool that had started talking. Your condition required prompt access to her skill set, he said. Calder's eyes flared. You set a charge on a roof to get access. Shaw stepped in again. You are admitting to an attack, she said sharp. You realize what you are saying. The man's gaze slid to Shaw patient. I am explaining operational reality, not seeking your approval. Shaw's hands curled at her sides. Operational reality does not override medical ethics. It does, he said softly, in places that do not have your ethics. Mara's voice cut in low. Do not talk about him like he is a route on a map. The man's eyes returned to her. We are not discussing him, he said. We are discussing the fact that a retired call sign answered tonight. Calder shifted on the bed, wincing. Tubing tugged. The needle line trembled. Mara's hand went to his shoulder, light grounding. Calder obeyed her touch with a grimace of frustration. You flushed her, Calder said, voice hard. You burned my perch to smoke her out. The man did not deny it. Your extraction breach was unfortunate, he said, but necessary. Evan made a small sound in his throat, a swallowed protest. His face had gone pale beneath his mask. He stared at the man as if waiting for someone to say it was a misunderstanding, a prank, an exaggeration. No one did. Shaw stared too, and something in her eyes changed. The part of her that believed every crisis could be handled by policy and procedure began to crack. Mara's voice stayed steady. You knew he would survive. We calculated likelihood, the man replied. Calder let out a harsh breath. Likelihood? You talk like weather? The man's mouth moved as if he might smile, but it did not reach his eyes. Weather is predictable. People are less so. You were predictable. You always fight restraint. You always resist sedation. You always hold until someone you trust gives you a different anchor. Calder's fingers tightened on the rail. You studied me. We studied outcomes, the man corrected. Your profile was useful. Shaw stepped closer, anger cutting through her composure. This is criminal, she said. This is assault. You will leave my bay now. The man turned toward her. His voice stayed calm. Doctor, you have done excellent work under pressure. That will be noted. But you are not in the decision chain. Shaw's eyes widened slightly at the casual cruelty of it. Decision chain, she repeated. I am the attending physician. You are, he agreed, and you will remain so, in this room, for the duration. O'Hara shifted his stance, squared up, trying to be brave. I am calling my supervisor. You cannot, the man said without looking at him. O'Hara lifted his radio anyway, thumb pressing the transmit. The unit gave a dead click. Nothing else. O'Hara's face hardened. What did you do? The man's gaze remained on Mara. Nothing that has not been done before. Mara's eyes narrowed a fraction. You could have asked. We did, he replied. Mara's voice dropped. When? The man held her gaze. We sent notice through channels, you once answered. Mara's expression did not change, but the air around her did. Silence is not an answer, she said. He nodded slightly. Silence is the only answer some operatives can give without being punished for speaking. Calder's eyes flicked between them. He looked like a man watching a familiar fight in a new room. This is recall, he said, and the words tasted like ash. The man turned his attention to Calder again, not unkind. Call it what you want, he said. We do not require her return to the field. We require confirmation. Mara's hands remained steady on the bed rail, but her shoulders stiffened. Confirmation of what? That you still exist, he said. Evan's breath left him in a thin hiss. Shaw's gaze snapped to him, then back to the man, as if she could not decide which part of the sentence to be furious about. Mara's voice stayed even. You walked into a hospital to confirm I exist. The man's eyes held hers. You chose a hospital, he replied. You chose a city that speaks in uniforms. You chose fluorescent rooms where faces change every shift. You chose a place where ghosts can pass as tired staff. Mara did not blink. I chose a place where people bleed and I can stop it. And yet he said the signature reappeared. Calder's jaw clenched. Her signature did not reappear, he snapped. Yours did. The charge, the pattern, the same way you burned my perch. The man did not deny that either. The pattern is a language, he said. It was used to test whether she would answer. Shaw's voice cut in sharp. Test. You are talking about human beings? The man looked at Shaw again briefly. Doctor, your insistence on moral framing is admirable. It will not alter the situation. Mara stepped half a pace forward. Not toward him, but into the space where he wanted her to retreat. Her voice remained quiet. You do not own me. I am not claiming ownership, he said, and the phrasing was careful. I am stating classification. Mara's eyes hardened. Say it clearly. The man held her gaze. You are reinstated under an advisory role, he said. Designation is inactive unless requested. You will not be approached again without notice. Mara shook her head once. No. The word landed clean. It did not wobble. It did not ask permission. The man's expression did not change. No is noted, he said, as if he were writing it in a margin. Calder's voice rose rough and angry. You burned men to get to her. The man looked at Calder. "You are alive," he said. Calder's eyes flashed. "That is your defense." "It is a fact," the man replied. Mara's hand squeezed Calder's shoulder lightly, a warning and a comfort at the same time. Calder's chest rose and fell more evenly now, but his anger made his breathing sharp. Shaw took a step forward and pointed at the instruments. "We are placing a chest tube," she said. "Now. You will step back or you will contaminate a sterile field." The man's gaze slid over the tray, then returned to Mara. He took one small step back, just enough to preserve the illusion that he respected her work. He did not look away. Mara met Shaw's eyes briefly, a look that said, "Keep moving." Shaw nodded tight jaw and turned to the procedure, reclaiming what she could. As Shaw worked, the man spoke again, voice low, aimed at Mara with surgical precision. "You will continue as you are," he said, "as long as you remain quiet, as long as you do not speak what you know, as long as you stay exactly who you pretend to be in these scrubs." Mara's eyes did not widen. She did not flinch, but Evan felt the words hit the room like cold water. Calder stared at the man. "She is not a file," he said. The man's gaze returned to Calder, calm. "She is the reason you are breathing." Shaw's hands moved with practiced speed. She did not look up, but her knuckles were white under the gloves. Mara adjusted the oxygen line and watched Calder's face for signs of drift. The flickering light stayed steady, as if even it understood the stakes. The man stepped toward the door with the same measured pace he had entered. He paused at the threshold and looked back at Mara once more. "You are both cleared," he said. "For now. Your reports remain sealed." "For now. Your reports remain sealed." The man let the words settle, then turned and walked out as if he had simply checked a box. His shoes made almost no sound on the tile. The door clicked shut behind him. The air did not rush back into the room. It stayed tight as if the walls were still listening. Dr. Shaw kept her eyes on her hands. She did not look up until the first incision was already made. She worked fast, controlled, and silent. Evan held suction tubing with fingers that finally stopped shaking. Respiratory adjusted the oxygen flow in small turns, watching numbers climb by cautious degrees. Mara stood close to Calder's left shoulder, her palm still a light anchor on his upper arm. Not pressure, not restraint. A point of contact that told his body where the present was. Calder's jaw clenched as Shaw advanced the tube. Pain flashed through his face, bright and ugly, then he swallowed it down. His eyes stayed on Mara. Not because he was weak, because he was choosing a target he trusted. "Breathe in," Mara said. He did the mask fogging. "Out," she said. His exhale trembled, then steadied. When the tube seated and suction engaged, a wet rush sounded through the line. The canister caught dark fluid and air bubbles that popped like tiny, furious arguments. Calder's chest rose deeper on the next inhale. The right side still lagged, but it moved. That was the difference between drowning and swimming. Shaw glanced at the monitor. "Better," she said, and she sounded annoyed that relief had found her voice. Evan whispered, "He is stabilizing." Shaw did not answer. She taped the tube-checked placement and pressed a gloved hand briefly against Calder's ribs, feeling for movement. Her focus was pure medicine again, but her eyes kept darting once toward the blinds, as if expecting them to shift without permission. Outside the glass, the corridor was quiet. The two suits were gone. The strip of visibility above the blinds showed only empty hallway and bright overhead light. The black bars still cut the world into a narrow frame. O'Hara approached the door again and tried the handle. It opened now. He stepped into the corridor, looked both ways, then came back in with his face tight. "They are not there," he said. Shaw's mouth pulled into a line. "My badge." O'Hara shook his head He had one since still blocked. Shaw stared at the reader by the door as if her anger could heat it into cooperation. She swiped her badge again. Red light. The small insult of it burned. Evan cleared his throat. "Do we call administration?" he asked, then immediately regretted the words. Shaw looked at him. "We keep the patient alive," she said. "That is what we do." Her tone was steady, but the crease between her brows had deepened. A doctor who had just been told she was not in the decision chain did not forget it quickly. She moved anyway, because moving was the only thing that still belonged to her. "Portable chest film in 15, she said. "No CT until his vitals can tolerate flat. We keep him angled. We keep him warm. We watch for re-expansion." Evan nodded. "Yes, doctor." He said it with relief, grateful for a normal order. Respiratory stepped back and listened to Calder's lungs again, one ear pressed under the stethoscope, eyes narrowed in concentration. "Sounds improved," they murmured. "Still diminished, but improved." Shaw's shoulders lowered a fraction. She pulled her gloves off and dropped them in the bin. Her hands were steady, but her pulse ran hard at the base of her throat. Calder's breathing smoothed out, not effortless, but workable. His eyes stayed open. He watched the blinds. He watched the door. Then he looked at Mara again as if checking that she had not been taken while he blinked. You are still here, he said. Mara nodded once. So are you. He swallowed. His voice came out raw, stripped of its earlier edge. Thank you. Mara's gaze went to the tubing, the dressing the needle site. She checked verified counted without speaking. Then she looked back at him. Do not thank me, she said. Stay awake. Calder's mouth twitched, not quite a smile. You always said that. The words made Evan's stomach drop. Not from fear this time, from realization. This was not a coincidence. It was a reunion in a place that did not deserve to host it. Shaw watched them both, eyes narrowed with questions she did not ask. She had learned enough tonight to know that asking could be a form of stepping into fire. A nurse approached the workstation, speaking softly. The lockdown is lifting, she said. The south wing doors are unlocking. As if on cue, the blinds on the glass wall shuddered, then rose half an inch. Not fully, just enough to change the room's air. The motor made a soft whir. It sounded like a file drawer closing. O'Hara tested his radio again. Static, then a voice. Normal chatter. He stared at the unit like it had betrayed him, then clipped it back to his belt. Shaw looked at the ceiling speaker as if she expected an apology. None came. Mara adjusted the oxygen line once more, then lowered her hand. The flickering light overhead buzzed, hesitated, then steadied. Calder's eyes twitched toward it, then returned to her without being asked. Good, Mara murmured, and it was unclear whether she meant the light or his focus. Calder's fingers loosened on the rail. He let his eyes close for one heartbeat, then opened them again. The room stayed where it was. Nobody had moved him. Nobody had strapped him. Nobody had put him under. He exhaled slowly. They always ask for the survivor, he said, voice low. Mara's face remained calm, but the skin around her eyes tightened again. Not in this room, she replied. Shaw glanced toward the door. Keen, she said quietly. Are you safe? Mara looked at her for a moment. A real look, not the polite one she used in hallways. Safe is a setting, she said. Not a place. Shaw held that, then nodded once, accepting that it was the only answer she would get. Evan hovered near the charting station, his mouth opened, then closed. He wanted to ask who she was. He wanted to ask how a nurse could speak about blast geometry like it was a recipe. He did not ask. Something in Mara's posture warned him off more effectively than a raised voice. Calder's gaze softened by a fraction. Not gratitude. Recognition with weight. They will not stop, he whispered to Mara. Mara's eyes stayed on him. Neither will you, she said. Calder let out a breath that almost sounded like a laugh. You know me. Mara's mouth moved the smallest shift at one corner, then settled back into neutrality. I know breathing, she said, and I know you do not quit. Shaw stepped toward the foot of the bed, reclaiming the practical. We move him to critical care as soon as transport is cleared, she said. He needs continuous monitoring. Calder's eyes flicked to the hallway again. No hallways, he said. Shaw hesitated. She looked at Mara. Mara's voice was quiet. Not yet, she said. Shaw nodded once, and in that nod, Evan saw a crack in the hierarchy that would not close fully. The attending physician taking input from the quiet nurse because the quiet nurse had been right when it mattered. Mara checked the dressing one last time, pressed the edges verified seal integrity, then withdrew her hands. She straightened slowly, as if standing too fast would bring the roof back into her vision. Calder's eyes tracked her. Where are you going, he asked. Mara did not answer immediately. She took a half step back from the bed, then another. She removed her gloves with careful precision and dropped them into the bin as if discarding evidence. Shaw watched her. Keen, she said softer than before, you do not have to leave. Mara's gaze shifted to the glass wall. The blinds were rising now, inch by inch, returning the corridor to view. White light spilled into the bay again. Normal footsteps passed by, normal voices, the world pretending it had not been held closed. Mara looked back at Calder. I am not leaving, she said. I am clocking out of this room. Calder swallowed. They used me to reach you. Mara's eyes did not flinch away from that truth. Yes, Calder's jaw tightened. I will not let them take you. Mara leaned in close enough that only he heard her. Her voice did not soften into comfort. It sharpened into fact. It is not your decision, she whispered. And it is not your fight tonight. Calder's eyes flared, then steadied. He was exhausted. He could feel it. He hated it. He let his head settle back against the pillow anyway because the air in his chest finally allowed it. Mara stepped toward the doorway. The staff parted without being told. No one clapped. No one praised. They simply moved aside, making space as if they had finally recognized gravity. At the threshold, Mara paused with one hand on the frame. She looked back once. Not at the door, not at the blinds, not at the place where the suit had stood. She looked at Calder. Stay awake, she said again, and this time there was something almost human under the words. Calder's eyes held hers. I am awake, he replied. Because you are. Mara nodded once. Then she turned and stepped into the corridor. Behind her, the fluorescent lights hummed. The monitor tones steadied. The trauma bay returned to its usual noise, but the room still felt marked like a clean sheet that would never be entirely white again. Down the hall, the service elevator chimed one more time.
Ding!
Mara did not look toward it. She kept walking shoulders level, pace unhurried, as if nothing in the building had the right to make her run. Thank you so much for listening to today's story. If this story resonated with you or made you reflect, I'd love to hear your thoughts, so feel free to share them in the comments below. And don't forget to like, subscribe, and hit the notification bell so you won't miss the next story.